must have seen all those articles or videos before and ignored. The problem of cervical cancer in our country is very real, and this should not be ignored or considered taboo. We need to talk about it openly. Hello and welcome. I'm Dr. Prasad Kasbekar, a surgical oncologist from Mumbai. Today we are diving into an important topic, the cervical cancer vaccine. Cervical cancer starts in the cervix, the lower part of the uterus. The two most common types are squamous cell carcinoma and adenocarcinoma. Squamous cell carcinoma is the most common type, forming in the flat cells in the cervix. This makes around 70 to 80% of the cases. Adenocarcinoma arises in the glandular cells inside the cervix, representing 10 to 20% of cases. There are also rare mixed types combining features of both. In India, cervical cancer is a leading cause of cancer-related death among women, with over 1.2 lakh new cases every year. India's mortality rate, with around 80,000 deaths, remains disproportionately high, which is approximately 11.2 per 1 lakh women, compared to the global average of just 7.1 per 1 lakh women. This makes prevention and early screening vital. Human papilloma virus is a DNA virus and is the main cause of cervical cancer. Many HPV infections usually cause no symptoms and resolve 90% of the time spontaneously. Sometimes an HPV infection can persist and result in warts or precancerous lesions. Nearly all cervical cancer is due to this HPV virus, and two strains, HPV 18 and 16, are accounting for almost 70% of cases. HPV 16 is almost responsible for 90% of HPV related cancers in the mouth, throat and tonsils as well. Up till now, more than 200 types of different HPV strains have been described. There are 4 vaccines currently available in the market. The first one is Cervavac. This is an indigenous vaccine developed in India and has been developed so that we can control the costs of the vaccine. This protects against the types 6, 11, 16 and 18. The second type is Gardasil 4. This also has protection against 6, 11, 16, 18. Gardasil 9, which is the third type, protects against 9 HPV types, including those responsible for the cervical cancer as well as genital warts. And the fourth type is Cervarix, which protects against the two main types, which are 16 and 18. The vaccine is recommended for both girls and boys between the age 9 to 14, but can also be given up to the age of 26. It works best if given before any sexual activity begins. Some studies have shown that women up to the age of 45 may also benefit depending on the individual risk. From the age of 9 to 14, usually 2 doses are given 1 month apart. But after the age of 14, the advised dosage is 3 doses given at 0, 1 and 6. Cervical cancer vaccine prevents up to 90% of cervical cancer cases caused by HPV. It also protects against genital warts and some other cancers linked to HPV. The vaccine provides long-lasting protection, with studies showing immunity lasting for 10 years or more. Most side effects of the vaccine are mild and short-lived. Sometimes pain or swelling at the injection site, slight fever or headache. Serious side effects are very rare and hardly been described in studies. The vaccine has been proven safe worldwide for more than 15 years of usage in the general population. However, these vaccines are slightly expensive. So Gardasil 9 costs around 3,000 to 5,000 per dose, and 3 doses have been ascribed. Cervarix is slightly cheaper, costing around 2,000 to 3,500 per dose. Government programs are now providing free or subsidized vaccines in many states through various school drives. Vaccination is available at government hospitals, private clinics, and even schools in some states. So hence, you should speak to your healthcare provider and find out more about the best option where you can get this vaccine. Remember one thing, the vaccine reduces the risk of HPV infection, but it does not completely prevent it. Hence, even if you are vaccinated, you should go through your regular screening in the form of pap smears every 3 to 5 years based on what type of pap smear you've taken. However, the chances of developing cervical cancer after vaccination reduces by more than 95%. Getting vaccinated is a powerful step to protect you and your loved ones. So hence, don't wait. Go and talk to your doctor today and take charge of your health.